Today we're going to start by reviewing how to take a blood pressure. Whenever we take our blood pressure or have any encounter with a resident, a patient, or anyone that we're serving, we always begin by introducing ourselves and telling them who we are and what we're going to do to them. Hi, Miss Kirsten. My name is Kim and I'm your CNA. I'm going to take your blood pressure. At this time, I'm going to gather my supplies. So the supplies for this skill would be alcohol pads, your blood pressure cuff, your stethoscope. However, when you go to take your test, you will get the dual lumen stethoscope. That way your evaluator will be able to hear at the same time you're hearing. Paper to record your findings, and of course a pen or pencil. Our next step is to make sure that their feet are firmly flat on the floor. Their feet should not be crossed. And then we locate their brachial pulse. The brachial pulse is on the inside of the arm, and we find that because that is where our stethoscope is going to go. We use our alcohol pad to clean our ears on the stethoscope, as well as the diaphragm. The diaphragm is the flat part. The bell is the part that has a little concave area. Test your ears, but tap lightly. Squeeze all air out your blood pressure cuff. All blood pressure cuffs have some type of marking that shows you where you want to put the cuff, whether over the left arm or the right arm. And the arrow or the marking will be pointed over where you felt that brachial pulse. So for Miss Kirsten, we're going to use her right arm. So I got to put the arrow right above where I felt that pulse. Fit it firmly around her arm. I left room where I can put my stethoscope. I put my ears in. And I inflate the cuff. I'm going to inflate between 160 and 180, so we're going to go right at 170. I would then return my materials to where I got them from. I would wash and sanitize my hand. So once we finish with the blood pressure, we return our supplies to the area. We give our resident, our patient, the call light, wash our hands, and then we come back and record the finding. Our skill is complete.